It used to be thought that women with ADHD were overrepresented there, but the inattention is the most persistent feature of ADHD across the age range. Now, the cognitive speaks to how people think about things. Now, nobody thinks themselves, and there's also an emotional component of ADHD. The person has faced very real frustrations. Trusting that they'll be able to change is part of the cognitive change. ADHD isn't your fault, but it is your responsibility.
Welcome to Khan Clinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing the top-rated personalities, not from only the US, but around the world. At Khan Clinics, our commitment is to bring you evidence-based information that inspires you confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. And they have commonly other emotional symptoms as well: anxiety, mood behaviors, mood disorders, and sometimes depression. Would you factor those in as well when you're looking at kids with ADHD? Do they really have to be hyperactive to be diagnosed as ADHD? Or they could be in a phase and they could have anxiety, they could have mood disorders, and they may not be that hyperactive to give us a glaring alert, hey, your kid may have some other issues going on.
Right. Hyperactivity, there's three presentations of ADHD. One is the combined presentation. Both parts of the inattentive symptoms, the difficulties with time management, sustained attention. And it's really not an attention deficit. It's more an attention allocation issue, getting pulled away and paying attention to maybe not the appropriate thing at the moment. There can be a predominantly hyperactive impulsive type where there's not the inattention, but I really haven't seen that one too much. But there is a predominantly inattentive presentation without the hyperactivity. And sometimes it used to be thought that women with ADHD were overrepresented there. But really what we're finding now, and teen girls, that the hyperactivity just manifests a little differently and doesn't get picked up as well. Or sometimes hyperactivity seen in boys is identified as such, but seen in girls, it isn't. The same symptom isn't recognized as hyperactivity. That might be part of ADHD. But the inattention is the most persistent feature of ADHD across the age range, and has increasing difficulties into adulthood. But going back to the mood and anxiety, yes, the top three coexisting conditions are anxiety, depression, or other mood issues, and often some substance use problems, even if not reaching the level of addiction. So these are all things to look for that can coexist with ADHD, but also you want to look for the differential diagnosis, particularly for the late identified adults or adults coming in for an evaluation as rule outs that might not be ADHD.
Dr. Ramsay, the inattentiveness is with or without distraction, or can it be just a lot of times without distraction and they're just inattentive?
Well, the inattention includes distraction. It can come without hyperactivity. But usually if you're hyperactive, that itself is distracting. But with distraction, poor sustained attention, the attention allocation getting drawn away and having a hard time refocusing, these are all part of the predominantly inattentive type, and the inattention that goes along with hyperactivity in the combined presentation.
Thank you for explaining. Dr. Ramsay, tell our audience, what is CBT? What does it stand for? And then we'll talk about why is it so important and what role does it have in adult ADHD disorders.
CBT stands for Cognitive Behavior Therapy. It's a form of talk therapy. It was originally developed as a psychotherapy for depression by Aaron Beck at the University of Pennsylvania, and there's other, but he's considered the father of cognitive behavioral therapy, and it's become a useful treatment for anxiety and a host of other diagnoses and life issues. And it seemed to be a good one, and myself and colleagues around the world started adapting it for adults with ADHD. Now, the cognitive speaks to how people think about things, and that was a central piece in depression, the negative thinking. Now, nobody thinks themselves into having ADHD. It's that executive functioning, self-regulatory difficulty. So much of the focus is on coping behaviors. But living with ADHD, and going back to that book title, You Mean I'm Not Lazy, Stupid, or Crazy, that's the self-talk, the self-attributions of many adults with ADHD. I'm no good at this. I'll never go to college. Not that you have to go to college to live a fulfilled life, but I'm no good at what I try to do. I always fail. And this might be based on some frustrations that people have faced. And the coping behaviors for managing ADHD and dealing with things like procrastination, disorganization. And there's also an emotional component of ADHD. Even though emotions are not listed in the diagnostic criteria, the emotional regulation, being able to down-regulate upset emotions like frustration or anger. And when we think about motivation, that's really upregulation. How do I feel enough like studying for the test in 2 days when I'll never feel like studying? And this is part of how these self-regulatory capacities are part of the human settings, but they're much more difficult for individuals with ADHD to manage. And that's what cognitive behavioral therapy targets. So that's why it's been so helpful for adults with ADHD.
A lot of times when people are told about CBT treatment, they start thinking of this is treatment is going to last for ages, repeated visits to the doctor. It's long sessions sitting down. Is that and we know in some cases, for example, in insomnia, they use it for CBT is a very effective treatment, but sometimes it doesn't work. And the ratio of it working versus not working varies a lot. What's your thoughts, Dr. Ramsay, on ADHD CBT treatment and how effective it is, and how long does it take to have its effects?
Right. It is personalized. I'd say a fair way to answer that first is I would say a good dose of CBT, based on some of the randomized controls and some work we did that weren't randomized but were early on. Many of the protocols are about 12 or 14 sessions. Now, usually in the studies, they're every week, but they can be stretched out to every other week. So I would say roughly the 12 to 20 sessions over about 6 months is a good dose, because you also want to spread it out over time to have time to practice, because that's part of ADHD. It's not lack of knowledge. We're not really telling anything new. Everybody knows procrastination, you need to start earlier, but it's an implementation problem. So that takes time because ADHD gets in the way of implementation. So, some sessions might come every other week and to stretch out over about the 6 months. Some people may do follow-up sessions over time as things change, as they finish college or as they have children. But the goal of CBT in general, even going back to depression or anxiety, is to empower people to have skills that they can use on their own in day-to-day life. And that's where the personalization comes in. So that's where there have been studies of once CBT has been discontinued and there's 3 and 6 month follow-up, that there have been persistent gains both on medications or when medications have been discontinued. Now, I don't want to oversell it because people can always drift and then maybe come back for booster sessions later on. And as I said, some people might just have regular monthly sessions as long as they find it useful.
And part of the CBT treatment is making sure that the negative thinking patterns are fixed. Isn't that the case with normal people as well? Any negative thinking patterns are fixed. How is it different in ADHD? Do they think more negative, or is there a complete roadblock? Or
Right. I think the thing with ADHD is very often the person has faced very real frustrations, setbacks, even failures, be it having been failing tests, having to retake a class, maybe difficulties with the relationships. So trusting that they'll be able to change is part of the cognitive change, and believing in the treatment long enough to implement the coping strategy. So the cognitive piece is, from my perspective, increasing that self-trust and backing it up with the behavioral follow-through, the B in cognitive behavioral therapy. There's also the emotional management piece, what I mentioned before, being able to soothe emotions and manage uncomfortable emotions. With procrastination, like studying is generally not fun, but being able to get started with it, even if you like to exercise, getting started on it can be difficult because you may not feel like doing it. That's part of the emotional piece. And then there's also a very important social relationship interpersonal component to ADHD, of being able to work and ask and accept help from others, reach out for help when need be, and also to tend to relationships. In addition to things like procrastination on school and work, follow through on relationship roles, parental roles. Those are other coping domains that CBT for adult ADHD, and to a different degree for children. It tends to be more behavioral with children and helping parents and teachers understand their students and their children to better support them. But so it's many manifestations across the lifespan.
and what responsibility would you place on the families and the friends that surround someone who has ADHD?
You know what? One of the things we say, a line we have about ADHD isn't your fault, but it is your responsibility. So the individual with ADHD, and I'll say with the adult, because children, they're children and they need support from parents and teachers and whatever. So there is the importance of following through with treatment and coping. Now, the people can be supportive, and a lot of it is psychoeducation, gaining an understanding of how ADHD manifests. And this is where there's some cognitive work by loved ones, teachers, the thoughts, the attributions, how they explain the behaviors or the lack of behaviors or the impulsivity. And they can be difficult to face sometimes and frustrating, but being able to understand, be supportive, encourage people to follow through with treatment. And often, at least with adults, sometimes a partner or a sibling or a friend will come in and want to be part of the session just to better understand and learn about ADHD. And there are many materials out there to help, particularly the romantic partners or spouses of people with ADHD, to better understand and understand the features of ADHD and how to make some reasonable adaptations in day-to-day life to make life a little easier.
Thank you for explaining that, Dr. Ramsay. Dr. Ramsay, give us your final thoughts about what message would you like to give out to our audience, people who, especially families who have ADHD and have kids coping with them. I've seen a lot of times that there are families who have not one, two, sometimes three members who have been affected with ADHD. Their life revolves around looking after and managing them.
Right, right. There are many treatments out there that can be very helpful, and so encourage getting evidence supported treatments. At the same time, be it parents of children, friends and families of adults, don't overlook the positives, don't overlook the strengths. Not everything has to be about treatment all the time. And enjoying all the good things, the relationships, the positive qualities that people have. And it can be a both and, where there's some areas of life that can be a little more difficult to navigate through, but it can generally end up being a very positive experience, and celebrating the successes and reinforcing all the positive coping can lead to really great outcomes and great life and family experiences.
Thank you very much, Dr. Ramsay. We end with a brilliant note where you've mentioned that look at the successes, look at the positives. A lot of times we will oversee those successes when we have kids or family members with ADHD. It is a challenge and it can overwhelm you at times. But I think your insight, bringing what you brought today, has been really brilliant. We appreciate you being on the show.
Again, thank you. It's been an honor.
What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with people, someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Clinics.